After months of failed contract negotiations, Scripps Health has been removed from 125,000 San Diegans' Anthem Blue Cross insurance networks.
The most powerless people in this whole system are the patients right now. They don't have a say other than going back to their employer.
Nathan Kaufman is a healthcare consultant and the managing director of Kaufman Strategic Advisors.
Unfortunately, you have these for-profit insurance companies that want to grow, and they grow in their profits in part by reducing at least the rate of increase in the cost of hospitals. And then you have the hospitals who are usually governed by the community, who are seeing huge cost inflation and absolutely need the rate increases, not primarily to subsidize government patients. And so it's a mess.
No one from Scripps Health was available for an interview, but in a statement, Scripps says, quote, "Throughout the negotiation, Scripps's focus was to change Anthem's bureaucratic policies that cause unnecessary delays, burdens, and barriers to patient care. It is disappointing Anthem was unwilling to reduce those barriers and offered rates below healthcare inflationary costs." The statement went on to say, Scripps proposed to continue negotiations beyond yesterday, but Anthem provided an ultimatum that was unacceptable. Anthem Blue Cross was also not available for an interview, but a spokesperson provided the following statement. Scripps demanded drastically increased prices for patients covered by Anthem, increases that would have led to higher out-of-pocket costs for our members and would have hit area employers particularly hard. According to Anthem Blue Cross, more than 80% of their members are insured by employers that pay their employees' healthcare costs directly.
What the government has done is created an environment where essentially health systems are generating a hidden tax, right? They're basically taxing the employer for the underfunding of Medicare and Medicaid.
Scripps Health and Anthem Blue Cross both expressed they are open to discussion and coming to a reasonable agreement. Kaufman says agreements like this can be resolved in weeks or it may take months.
I am concerned that there is not sufficient capacity within the system for the other healthcare systems and physicians to absorb the Scripps patients who can no longer go to Scripps.
Scripps recommends its patients contact their employers' human resource departments about their health insurance options. Melissa Mae, KPBS News.